Has your doctor recommended that you monitor your blood pressure at home? Or perhaps you simply want to be more involved and in control of your health care? Whatever the reason, this program has been created to demonstrate the proper method for taking your blood pressure at home. Let's start with the basics. Inside your body is a complex network of blood vessels, arteries, veins, and capillaries. Your heart pumps blood into these arteries, which carry that blood all through your body. Blood pressure is simply the pressure or force of your blood pushing against the walls of your arteries. High blood pressure, also known as hypertension, is a serious medical condition where the pressure in your arteries is above the normal range. If it is not treated, hypertension can damage your heart, brain, and kidneys. Blood pressure is expressed as two numbers. For example, 120/80. The first number is called the systolic pressure. This is the pressure in your arteries when your heart beats and fills them with blood. The second number is the diastolic pressure. This is the pressure in your arteries when your heart rests between beats. When blood pressure is measured in a doctor's office, hypertension is diagnosed when someone who is otherwise healthy has a blood pressure of 140/90 or higher. But according to recent guidelines published by the American Medical Association and the European Society of Hypertension, when you measure your blood pressure at home, a reading of 135/85 should be considered to be hypertension. When you are purchasing a blood pressure measuring device, bear in mind that devices that use arm cuffs are the most reliable, making them the best for measuring blood pressure. Also, make sure that the blood pressure cuff size is right for you and that it fits properly around your upper arm. After you purchase your device, bring it to your doctor's office so the doctor can make sure it is working properly. You should have your doctor check the device once a year. You should also ask your doctor how often you should check your blood pressure. You will have to make an appointment for a nursing visit in addition to the physician office visit on the day you are having the device checked. Before you use the device, be sure to read and follow the instruction manual. And keep in mind that there are several factors that can cause your blood pressure to rise temporarily. To make sure the readings you receive are accurate, you should not measure your blood pressure if you are experiencing stress, have been smoking, have been exposed to cold temperatures, have been exercising, recently finished eating, need to use the bathroom, have recently had caffeine, or have recently taken cold or pain medicines. Take your blood pressure the first thing in the morning before you take any medications, and at night before you go to bed before you take any medications. You may find it easiest to measure your blood pressure in your non-dominant arm. For instance, if you are right-handed, you should take your blood pressure in your left arm. When you measure your blood pressure, take 3 readings. Wait at least 1 minute between readings. And don't worry if one of the readings is high or low. Blood pressure readings tend to vary a great deal. Before taking your blood pressure, sit quietly and rest for 5 minutes in a chair with a backrest and with your arm supported on a flat surface. Your arm should be at the same level as your heart. Sit up straight with your back against the chair and your legs uncrossed. To begin, locate your pulse by lightly pressing your index and middle fingers to the inside center of the bend of your elbow. Here, you can feel the pulse in your brachial artery. If you are unable to locate your pulse, you can still measure your blood pressure. Place the arm cuff of the blood pressure monitor slightly above the bend in your elbow. Next, slide the blood pressure cuff onto your arm. You may need to roll up your sleeve. The lower edge of the cuff should be about 1 inch above the bend of your elbow. Use the Velcro wrap to make the cuff snug, but not too tight. Next, press the power button. All display symbols should appear briefly, followed by a 0. This indicates that the monitor is ready. Sit quietly and watch the monitor. Blood pressure readings will be displayed on the screen. On some devices, values may appear on the left, then on the right. Most devices will also display your pulse rate. Wait for a long beep. This means that the measurement is complete. Note the pressures on the display screen. Allow the cuff to deflate. If you did not get an accurate reading, do not inflate the cuff right away. Wait 1 minute before repeating the measurement. Start by reapplying the cuff. Record the date, the time, and your systolic and diastolic pressures in a notebook or diary. Before your next doctor's appointment, you should record at least 2 morning and 2 evening readings every day for 1 week. Throw out the readings of the first day. This will give you a total of 24 readings. Your doctor can use these readings to help make decisions about your treatment. And always remember, while monitoring your blood pressure at home can help your doctor evaluate your health and treatment, it is not a substitute for regular checkups.